if I'm doing the fundus, and the fundus is usually, like this. So when I take a picture of it, it's just a piece of meat. That's the easiest way to describe it. But if my fundus does this and it's heart-shaped, that's called an arcuate. Okay, that's called an arcuate. That's letting me know that I could have a septated uterus. Because why? This could be a septation. Okay?
In the
I'm sorry?
future? In the future? Or?
No, right now.
Okay.
Because I'm not gonna do this to a newborn.
Hmm.
Well, we do it to newborns, but, and we are gonna look. But if it, I'm confused about your question.
Oh.
It's never in the future, it's here and now.
Oh.
It will never change.
She thinks it's going to develop in the future.
Yeah, it will never change. Once the Mullerian duct has done its job, this is what we get. Okay? But if you see the heart-shaped fundus, we describe that as an arcuate fundus.
On the bicornuate, does that have blood supply in the middle, or that doesn't?
A bicornuate, yes, it's two separate uterus. It's two separate uteri. Okay? This, if I saw this just at the fundus, I would label that arcuate fundus. See how it's kind of heart-shaped? See how this is kind of heart-shaped? So if it's heart-shaped, they're gonna order other exams, especially if the woman is going through infertility treatments. They're gonna order more than what we do. Okay? Exactly. And if I have a bicornuate, if I have a didelphus, left midline, left lateral, left medial. Okay? They're individual organs.
Is the arcuate only whenever it's
When you see the fundus do this, we call that arcuate.
when you have arcuate, when it's just.
This is arcuate.
When it, no, when it's just, one like.
No, you would never see that.
Those with the double.
Yeah, you only see arcuate when something else is going on. Okay, so this is a unicornis. So what is a unicornis? Uba. What's a unicornis? Only because uba and una.
Is one just one? So like two?
Nope.
It's filled up.
Uni.
One.
Yeah.
One.
I have one cornua. What is that area where the fallopian tube inserts into the uterus? That's called the cornua. That's the easiest way to remember it. Okay? Unicolus or unicornis. You're going to hear it called two separate things. Okay? So here is a unicornis under radiography. Now, radiography, we can do a pelvic exam with the same catheter, like a HSG catheter, except for they put dye in there, a contrast that shows up under x-ray, okay? And it spills out into the abdominal adnexa, so we can see that the fallopian tube that we can't see on ultrasound, but you can see on radiography, because it has a contrast or a dye in there that shows. The body just absorbs the dye. Okay? So we can see that this is a normal uterus. This area here is called what? Cornua, because that's where the fallopian tube inserts into the uterus. Here I have injected, but I only see 1/2 of a uterus. And I see that I have contrast spilling out into my adnexa. So I know that I have an open fallopian tube or a patent. Patent means open. Okay? Bicornuate. A bicornuate is a complete duplication of the uterus. It does not involve the cervix or the vagina, but sometimes you'll have an arcuate deeper than 1 centimeter. The fundus can be into a heart shape. That's what it means by cleft, making the fundus heart shaped. So here is a bicornuate uterus. This is what we see transvaginally. This is the right uterus. This is the left uterus.
Most likely patient
No.
So,
Why would they if they've never had an ultrasound?
so
when I'm scanning, is that just information I'm keeping to myself?
Oh, you never say anything to the patient. You say something to the patient, they will jerk your license away from you. You know why? You know why? You're practicing medicine. If you practice medicine in imaging, you will lose your license. Do not do it. Oh, but please, 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 just tell me. I won't say anything. I'm not a doctor. I'm only a technologist. Downgrade who you are. I'm just a sonographer. I can't give you any information. Because if the ARDMS finds out that you are routinely give diagnoses, they will jerk your license and you will never work again. Yes.
In MFM, you tell them the baby's valid or breech? Is that something you can say?
No, I don't tell them anything. You'll have to find out from your facility how much you can say. A lot of times, those facilities won't even let you tell them if it's a boy or a girl. They have to find out from their physician. Okay? It depends on where you work.
What if the patient is aware of,
They'll tell you.
right, and so for example, this is an example I had yesterday, these ladies were aware of their cysts, so they were asking questions like, so is it bigger?
Yeah. So, well, I don't know. I have to look at your old films yet.
Okay, but I guess my question is that something I can answer?
No. You know, I'll compare them to your last exam and you'll get your report from your doctor in 2 or 3 days.
Can you ask them questions like when you look in, because I saw my sonographer looking at their history,
Uh-huh.
and then she would ask her questions about,
You can confirm.
okay,
You can confirm. You can't ask, but you can confirm. Does that make sense?
like you got this done and,
Yeah, I see you had an exam in 2016 and they were, are we following up on a uterine, whatever you read? No, she goes, no, there's something different. Okay? You can confirm, but you can't zip. Just smile. I'm just a sonographer. I'm sorry, I can't tell you.
Some offended women are extra sweet.
Huh?
Some of these offended women are very extra sweet. If you choose to say something.
Oh, yes, they will. They will. And you'll get some that are really, really nasty. And you know what you tell them?
Just for that, I'm not gonna tell you.
No.
Yeah.
say, I'm sorry, but if I tell you, I'll lose my job. It's not part of my job description. And I've even had to say, you knowing if it's this is a lot less than me losing my job. So stop asking. I'm not gonna tell you, so stop asking me. And if you want my supervisor's number, here's her card.
Wow.
I've even had to take people to administration because they were so ugly to me. I'll answer that question for you in just a minute if you'll follow me. I don't even call. Go straight to administration. Go ahead and step in and have a seat in that chair right there. I'll be right with you. I go in and I tell my supervisor, I'm having a problem with this patient. He's being ugly with me. He wants me to tell him things that I can't tell him. Could you please explain to him that I am not allowed?
And then they'll say exactly what you just
They'll
said.
say exactly what I just said.
So
And for
we're
some
not
reason,
gonna get in trouble, like if they do those customer surveys and we won't tell them, or we won't tell them anything.
Oh, sure, they're gonna count you off on it. But that's your job.
Yeah.
That's your job. You're doing your job. What do we call it? The scope of practice as far as we can take it. And so they're gonna write on that survey, oh, Anna did my exam and she was super, super sweet, but I'm gonna give her, but she wouldn't tell me my results. Do you think they're gonna pay attention to that? They're gonna throw it in the trash. Because you're practicing your scope of practice. Oh, I'm late. Why didn't y'all tell me?
Can you like your story?
Because we didn't know.
Okay. Okay, so we haven't finished, so we'll start this slide here.
Jazzy,
Is it not have a slide number?
Claire,
Thank you.